Here we see a newborn baby with pus discharge from left eye on day 2 of life, which occurs due to infection. Method of cleaning. Step 1. Boil a little amount of drinking water. Step 2. Cool down that water to room temperature. Step 3. Wash or sanitize your hands properly. Step 4. Soak a clean cloth or gauze piece in that water. And step 5. Clean the eye with gauze piece in the direction of medial side towards the lateral side. The baby might need another medication in addition. Showing your pediatrician is advisable.